Good morning. I'm here to talk to you today about the Garrett THD tactical handheld device. This piece of equipment is going to go a long way in helping you to detect metal objects, threats to your facility. And we're going to talk a little bit about the functions of this device. It turns on simply with the power button located right here. When the device is active, you'll see a green light. Once it detects metal, you'll see the red indicator light come on, accompanied by a vibration. The light you see here, which we'll demonstrate later, is an LED flashlight. And that's going to help you as far as searching through bags, purses, backpacks. The THD is a pinpointer device. This barrel is active 360 degrees all the way around, and so is the tip. The THD that you're going to be receiving soon at your sites is run by a 9-volt battery, the same as the other handheld metal detectors by Garrett. THD is not only going to be useful for searching patient belongings or visitors, people coming through your magnetometer that need a secondary search. It's also going to be very useful when you're scanning wheelchairs and patients arriving via EMS. Remember, one of the key features of this is that it's a pinpointer. What does that mean? Just as the barrel is 360 and detects metal, so too does the tip. 1 to 2 inches off a person or off a target area will pick up metal, and you will know exactly where the metal is being picked up at. Utilizing this in a wheelchair where the risk of ambient metal is great due to the design of the chair itself, using the pinpointer feature will allow you to search a greater area without fear of contacting that ambient metal. The same with the stretcher. When an EMS patient arrives, using this in pinpoint mode, when you're getting near the sides of the stretcher where ambient metal may be a concern, is the best practice, and it will yield in a more successful search. So looking at this metal detector, the THD, the first thing you're going to realize is it's quite a bit smaller than the normal wands you're used to using. All right. It's compact, it draws less attention. The fact that it alerts you by use of a red indicator light and a vibration and not audio alarm also will help in keeping our patients from being embarrassed or drawing undue attention to the actions that we're taking. This works the same way as any metal detector. As I said before, it must be in motion. Things to keep in mind: this does not have the same length or width of the handheld devices that you're used to using. So best practice, one side, the center, the other side. About an inch off the surface, an inch to 2 inches. Best practice would be 1 inch to gain the full advantage of the device, and in 3 sections. You can start in any direction, right to left, left to right. Just remember, when you're scanning the torso, you want to do it in 3 zones: side, center, final side. The belt line, another area where concealment is common. Down each leg, through the pocket areas, from hip to ankle. Same thing on the other leg. That's my car keys. From hip to ankle and inside. And of course the back as well. Down one side of the back, shoulder blade, down the center, to the back to the small of the back at the belt line and down the other side. Split it into threes. This will pick up and detect any metal that the person has anywhere on their body. A best practice for scanning containers that are brought in, purses, backpacks, knapsacks. Take your THD, hold it about an inch off of the item you're searching, and scan. Like any handheld magnetometer, the magnetometer must be in motion to detect metal. As you use the THD, you're going to learn to identify how much metal that you're dealing with. In doing the outside of the bag, we identify potential areas where metal may exist, where a threat may be present. As you can see, as I scan the back of the bag, I'm receiving a detection. As I scan the front of the bag, I'm not. The side, the opposite side. Let's concentrate on the areas where we had a positive detection. Keep the flashlight button depressed at all times so you can see into the bag. We know that there was a detection to both sides and the back of the bag. Using the barrel of the device, let's now take a look. I'm receiving a detection in the center as well. Nothing to the back. The detection on the side. So if we remove this device, that's what we found. Continuing to search, we know we had a detection to this side. We remove the device. This is what we found. In looking at this bag, you would think that it's clear. All we have left are clothes. We've already gone through this with the barrel. However, if you recall, when I first went in here with the THD, we had a detection in the center. Move it around. Find that detection. So the THD is detecting to this rolled up pair of socks. If you look, you'll see no longer is there a detection. The red flashes that you're seeing now are off the back of the zipper. Keep that barrel as far away from the zipper, but still inspect the center. No further detections. When we use the squeeze method on this roll of socks, there's something hard inside. Upon further inspection, we determine a secondary knife.